Hello and welcome back. So today we will start our lecture on important fetal infections. We will mainly focus on torch infections, and we will go through them one by one, the important ones only. Anyways, here is a list of important infections which any doctor practicing in obstetrics, they should know about it. First is rubella. So in this lecture, we are going to discuss rubella. Then the second one is toxoplasmosis, cytomegalovirus, syphilis, chickenpox, herpes zoster, herpes, genital herpes in pregnancy, HIV, group B streptococcus, hepatitis B, and hepatitis C as well. And there is one infection, hepatitis E. So there are some infections in pregnancy which are not which do not have disastrous consequences when they affect non-pregnant people, but they can have very serious consequences, increased mortality rate and morbidity if they infect a pregnant woman. One of them is chickenpox, and second one is hepatitis E infection. Okay, so these two, especially in pregnant women, they can have disastrous consequences. So now we'll start with our main topic, which is rubella. Rubella is also called German measles. Okay, that's another name for it. Please do not confuse it with rubeola, because rubeola is measles. Okay, so it's a single-stranded RNA. It's a viral infection, and incubation period is 2 to 3 weeks. You do not need to remember these periods, but still, 80 to 90% people are immune by age 15. So most of the kids, they already get it. Okay, and immunity is lifelong for rubella. So once some person gets rubella, and that's it. Okay, and if mother is non-immune, baby can be infected. So how is that? So if a mother was not infected before pregnancy and during pregnancy, especially in the first trimester, early first trimester, she gets rubella, then baby can be infected and it has disastrous consequences for the baby, okay, in the first trimester. It can be acquired through inhalation or by vertically through baby, okay, through the mother, through placenta. So it's called vertical transmission. So congenital rubella infection, it can, because as I said, in the first trimester, it has very serious consequences. Why is that so? Because we know that in the first trimester, new cells are being formed, right? So there is hyperplasia. So as a result, it can cause chromosomal breakages and inhibited mitosis in infected embryonal cells, and baby can be severely infected. Now, how to diagnose? What's the diagnosis? So sometimes, actually, almost half of the cases, they are subclinical, which means women may not even notice it. Or mostly, like in viral infections, it can be just mild disease, especially just body aches and pains, generalized body aches and pains, mild fever, and then, yeah, there can be lymphadenopathy. Lymph nodes may be enlarged if a doctor examines, or and there may be a transient macular rash, okay, which usually lasts for 3 days. So, because rash can be a presenting complaint in many infections, so what is the characteristic feature of this rash? It's actually a spotty rash which starts from the face and even behind the ears, and then it spreads to the rest of the body downwards. Okay? But the problem is, even before this rash is developed, if the mother has rubella, right, she can spread it to other people. Okay? So infection can be spread even 1 week before onset of rash to 4 days after a rash. Okay? So, so it usually starts as small patches and bumps on the face. The spots grow together to form larger spots, and then it quickly spreads to other parts of the body. It does not usually affect the palms and soles. Okay, it usually fades after 3 days in the same order in which it appears. So it appears from the upper part of the body and it starts to fade in the same sequence. Now, what are the consequences, possible consequences for the baby? It actually, the main thing is at what stage the baby is infected. Okay. If the fetus is infected in the first 4 months of pregnancy, okay, there is typically 4 months, which is like first trimester, but the risk still persists actually till 20 weeks. But especially the earlier it is, the worse it is. The first 4 months of pregnancy, high incidence of congenital infections, which is called congenital rubella syndrome. And now in congenital rubella syndrome, it can affect many organs, okay? First is cardiovascular system. So it can cause patent ductus arteriosus, ventricular septal defect, pulmonary artery stenosis, and many other problems related to cardiovascular system. In the eyes, it can cause cataract, glaucoma, retinopathy. In the ears, this is an important one, it can cause sensorineural deafness. A hair, so it can cause microcephaly, which means a small skull, okay, a small brain, splenomegaly, mental retardation, meningoencephalitis, okay, so infection of the meninges and the encephalitis. So fetal infection in later pregnancy, usually most of these, they do not happen, but in later part of the pregnancy it's just isolated deafness, okay, which will again be the same type, okay, sensorineural. Now on pregnancy, how does it affect? So if, say for example, if a patient is pregnant in the first trimester, in this pregnancy she has increased risk of having a miscarriage, okay, but she develops lifelong immunity. So once a person gets rubella, it gives lifelong immunity. It's like chickenpox, okay, so chickenpox and rubella, they have lifelong immunity. Once you get it, you are protected for life, okay. And then in the future pregnancies, they are protected, okay, so, and it does not cause recurrent miscarriage, so it's only the current pregnancy. Now, how to diagnose? It's by serology. Serology means taking blood samples and then looking for antibodies. But see, so now there are different types of antibodies. We will talk mainly about two, right? One is IgM, which develop in an acute infection, and there are IgG antibodies, which show that a person is immune already. For example, almost everyone got corona vaccine, right? So once we get corona vaccine, now we should have IgG, okay? So because we got the vaccine, we got it passively, and then we should have IgG in our system. But if someone got, for example, uh, active infection, the body develops antibodies as a protective mechanism. So the acute infection, that is IgM type, okay? Now, for rubella, we have to do serology, which means doing the blood test initially, okay, and then we can do PCR later. Now, rubella IgM antibodies become detectable within about 7 to 10 days after the onset of rash or symptoms, and remaining detectable for several weeks to a few months. That means even if a woman is infected today, and if we check rubella IgM tomorrow, for example, right, they may not be detectable, okay, because the body takes some time, okay. But still, if IgM is positive, that means yes, okay, it's an acute infection. It can be detected in the fetal blood if sampled. So how can we detect fetal blood? So there are many ways. So one of them is called chordocentesis. It has, of course, risks to the baby. It simply means that this umbilical cord, take a blood sample from the umbilical cord. Of course, it needs a needle under ultrasound guidance, but of course it has risks, right? We can introduce infection, there is associated risk of miscarriage and so on, okay? Now, and especially in very early pregnancy, it may not be possible, okay? So it's actually the serology, maternal serology. And then we can do this confirmation by PCR test, okay? Now, the problem is, if someone is infected, what is the treatment? Unfortunately, there is no medicine which can treat rubella. Okay, so there is no antiviral, but we can give her symptomatic medication. For example, if she has fever, give her antipyretic. If she is dehydrated, give her fluids, sort of that thing. But underlying cause, it can't be treated. Now, how can we prevent it? It comes usually the vaccine as measles, mumps, rubella vaccine, MMR. Okay, if you remember, all infertile women, all women who are trying to get pregnant, we do rubella testing, okay, to see whether they have immune or not immune. Why is that so? Because ideally we should vaccinate women before pregnancy, those who are not immune. But once we vaccinate these women who are trying to get pregnant, they have to avoid pregnancy for at least 1 month. Previously, the guidelines said at least for 3 months. The new guidelines, it has been a few years, they say for at least 1 month. But just to be on the safe side, just keep in mind at least for 1 month, 1 to 3 months is better. Okay. So, rubella vaccine, can we give it if a woman is already pregnant? It's contraindicated. Why it is contraindicated? Because it's a live attenuated vaccine. Okay, killed vaccines are usually safe in pregnancy, but vaccination is safe in breastfeeding. Immunity after vaccination is at least for 14 years and maybe lifelong. We don't know, but it's like for at least for 14 years. That's what some books say. Now, so usually a lot of people, they used to do, I don't know whether they do it now or so, especially in Australia, they used to have these rubella parties. That means if one child had rubella, so they invited all kids so that they get it, right? Um, so, what to do with the baby? Now, it depends on the period, right? At what stage the baby got it. If the fetus has confirmed rubella infection, then offer termination of pregnancy. Anyways, even in it may be difficult to confirm, right? So, early first trimester primary maternal infection, less than 12 weeks, high risk of development of congenital malformation, so offer termination of pregnancy. Okay, so in first trimester, if mother has got it, then discuss that these are the serious consequences and there are very high chances that the baby can have it. So it's just offering termination of pregnancy, and the parents may accept it, they may not accept it. 12 to 20 weeks prenatal testing, is risk is comparatively lower. Okay, so in the early first trimester, yes, 12 to 20 weeks, yeah, we can perform an anomaly scan. Yeah, we can see, we can even perform maybe a cordocentesis if facilities are available, if the parents allow, and then decide. And then after 20 weeks, the risk is minimal. Okay, so it's the first trimester, early first trimester, which is the most risky one. That's it for now, and in the next part of the lecture we will do toxoplasmosis followed by uh,